Hello and welcome to the Health Show. My name is DiBella and I'm your host. Today we have a very interesting guest. His name is Dr. Michael Jordon. He is a professor, a urologist. He's an MD, surgeon, and he's an inventor of the EXMI chair. Welcome, Dr. Jordon.
Hello, Sal.
Well, I want to start off by asking you to for the viewers that are seeing you for the first time, to let them know what your credentials are.
Well, I'm a professor for urology. I'm practicing medicine since '86. I have my own practice in Munich, Germany since '95. And I'm an innovator, and I'm a fighter and a patient lover.
That's great. That's great. There's not many doctors that I heard that ever say that, but that's great.
Well, I found that this is my drive, and I dedicated my life to make other lives easier, better, longer, healthier.
Okay. Now, can you explain to our viewers what the EXMI is?
Well, EXMI is a special patented technology called extracorporeal magnetic innervation. It's a pulsed magnetic field that is able to get into the body to a penetration depth of up to 8 centimeters and depolarizing nerves. So if you compare what exists on the rehabilitation market, electrostimulation, for example, which is actually the competition of the XMI, the penetration depth is 1.2 centimeters. So comparing 1.2 to 7.8 to 8 centimeters, then you understand that if you want to get deep into the body because you need something deep to treat, the only technology around the globe that can make that is the EXMI. And the EXMI can be introduced in more devices. One of the devices is the magnetic chair called NeoControl, where you sit fully dressed in a chair and the magnet goes like a pyramid, like an apple, 8 centimeters diameter into your body. So the whole pelvic floor will contract up to 18,000 times in 20 minutes, and you're fully dressed. Comparing, for example, electrostimulation biofeedback, when you introduce a probe intravaginally or intrarectally twice a day, 20 minutes for 6 months, versus sitting fully dressed in a chair 2 times a week for 20 times, I think this explains everything that you need to know. From my point of view, technologically, the technological gap between what exists on the market and what I do is like comparing the coin telephones with the iPhone 6S. This is what we do.
Okay. Now, what incontinence is one of the uses for this chair? Is that right?
Yes, it's correct. So we have since 1998 an FDA approval for incontinence in women and prevention of muscle atrophy. So when you want to build muscles, you can build the muscles with only 20 sessions, because in 20 sessions with 18,000 contractions in 20 sessions with different frequency programs, you build a muscle on the maximum physiological capacity. So you can treat both stress incontinence, and overactive bladder, so urge incontinence. You can treat feces incontinence after radical prostatectomy, actually.
Okay, and also for I read a little bit about you know, what it's good for, but why don't you explain the other things that it's good for?
Well, the chair, if you think that actually what you do is a nerve depolarization, with the depolarization you control the muscles, and with the muscle activity you increase the blood flow, and with the nerve stimulation actually you control the brain, or you rehabilitate the brain, then if you combine nerves, muscle, and blood flow, then you understand that the side effect that we saw initially, positive side effect, is that you can treat hemorrhoids, you can treat vaginal tightening, you can treat chronic prostatitis and pelvic pain, you can treat erectile dysfunction. For example, diabetes patients, they all have neuropathy and vasculopathy. So they get medication like Viagra, Cialis, Levitra, whatever they call them, and this medication only works to maintain the vessels open. The problem with the diabetes is that you don't open the vessels. You don't really see diabetes running, because if they would run, they will not have diabetes. So actually the patient is I hope the people hearing me will not be mad at me, but actually the diabetes are lazy dogs. They don't want to work out, because if they would work out, they will actually treat themselves the diabetes. So I come with this instrument and combine the medication with the EXMI, and only in the combination many people would have a profit. And for example, also blood flow, diabetes ulcus, hemorrhoids. We can cure with this EXMI a diabetes ulcus 10 times quicker than anything existing. If you would combine oxygen therapy with that, increasing the blood flow, you can treat a lot of problems in diabetes, also in treating tumors, because tumors, if they get oxygen and a good blood flow, the immune system would kill the tumor cells.
Right.
So we can, it's not off-label use. In Europe, I can do a lot more things than you can do in the United States with that. But it's an instrument put in the hands of the doctors to help patients have a better quality of life, to have another options for cure some problems, or to improve some problems.
Right. Now, I just want to let the people know, the good doctor here, he's from Munich, Germany, and this is where we're talking to him from. But getting back to the diabetes that you were talking about, yes, the people are going to say, maybe get mad, but it's really something that they can control. I have a book out there on diabetes where you can control through exercise, and if you're too old or you can't exercise, then you could also control it with diet, you know, and diet, you can get rid of it. You can get rid of the diabetes also.
It's something that you can cure.
Right.
This is what the people should know. It's exactly like tumors in an initial stadium. You can cure it if you wanted to.
Right.
The problem is the discipline, is the self-discipline. Most of the patients, both diabetes and tumor patients, are not disciplined enough to take their lives in their own hands and make some cut decisions in their lives to change their lives.
Right. You know, for 28 years, I've been helping people with cancer and diabetes and heart disease through the mind-body connection. Now, I'm thinking about now making a CD for people to stop eating, people that are sick, to stop eating a lot of carbohydrates, sugar, and all the things you shouldn't eat to get well. I don't think there's another CD out there like that. So that's what that's on the horizon for me, to try and make something for people. I've made many CDs for people, tapes years ago it's called. But I made so many, and so many people benefited by meditation, by taking the anxiety out of their body. And weight loss too. I made weight loss tapes for people. Now, this is why I don't think there's one other out there, but I'm working on now making a CD for people to eat the right foods so they can heal their body, build up their immune system the way it should be. So let's get back to what you were saying. You talked a little bit about prostatitis. Now, why do some people get prostatitis first? And secondly, they get an inflammation in the prostate, and then maybe 10 years later, they get the inflammation. Get the prostatitis back with the infection. Now, why does that happen?
I can explain you very easily, and it's I have a very plastic way of explaining that to my patients, and I hope this will help a lot of your people hearing your show to understand what happens in the prostate. So actually, the prostatitis is a ascendant infection. It only comes through the urethra. It doesn't come from anywhere else. So actually, it comes from sex. So you introduce some bacteria through sexual intercourse into your prostate. You develop a small inflammation, infection, okay? Now comes the big problem. When you have some small symptoms, like you have a burning in the urethra, or you have an unpleasant feeling in the pelvis, you go to your doctor and they diagnose it as a urinary infection, and they treat it as a urinary infection with antibiotics for 3, 4, 5 days. And that's the biggest problem. The problem is that the prostate is a weak flowed organ. So if you put the medication in contact with the prostate only for a couple of days, and with a medication that doesn't go deep enough in the prostate, the medication will not get there in the first place. Okay? So I tell you what happens. So you have the urethra, then you go in the prostate big channels, and these channels will be smaller and smaller and smaller, like grapes, you know? And finally, you get to the gland, to the grape, okay? Now imagine, in that grape, you get an infection. Through the infection, you have a small swelling. So the channel that goes into the grape swells. So the fluid that is secreted from the prostate gland is very rich in minerals, okay? So the inflammation gets the water out with a diminishing of the diameter of the channel. This fluid combined bacteria with minerals cannot get out and will make a seed. It's a prostate stone. So the prostate stone, when the inflammation goes away, this stone cannot get out of this grape. It stays inside. So these prostate stones that you see in ultrasound as calcifications are not like kidney stones, like crystals. They are like corals. It's a living stone. So inside the structure of this stone, inside the gland, there are bacteria. Okay? So when you get months later, years later, low immunity, like cold, whatever, stress, your body is not in a good shape, whatever you do, toxicity, alcohol, whatever, okay? The immunity goes down, so this bacteria from the stone tries to live their life cycle. So they get out of the stone, go through the channels, and try to get in other glands to multiply themselves. And the prostate fluid is very rich in nutrients for the bacteria, so you will have an acutization of the chronic prostatitis. So as soon as you diagnose, actually you should diagnose in ultrasound prostate stones, actually you should diagnose a chronic prostatitis, in my eyes. There are some opinions, this is my opinion, and in my treatment way of doing that, it works. Because these people will come recurrently. So if you do not treat the first prostatitis correctly, you will have a patient for life. If he lives a good life, maybe you see him a couple of years later. If he doesn't live a good life, you will see them a couple of times a month, sometimes. And the prostate stones will multiply, so sometimes you see a fully stoned prostate in ultrasound. This patient with this inflammation, chronic or recurrently inflammation, they have a lot of pelvic pain, so sometimes they are such in pain that they are almost suicidal. Okay? The problem is how you treat them. The problem is with the treatment, if you search in Google and all the medical books, you will see treatment of the prostatitis, anti-inflammatory antibiotics, 10 weeks, 8 to 10 weeks. You give somebody 10 weeks antibiotic, you destroy his bacterial flora from the intestine, you damage his immune system even more. The problem is the weak flowed prostate, you don't get the medication inside. Here's where I developed a treatment option for these guys, putting them in my EXMI chair. You let them sit in the chair 20 minutes, you give them a suppository with anti-inflammatory in the rectum before they sit in the chair. They sit in the chair for 20 minutes, they get 18,000 contractions of the whole pelvic floor in 20 minutes, increasing the blood flow, and during this time, I give them an antibiotic in the V. So I have a hot spot in the pelvis with the blood flow, and I give them intravenously the antibiotic that will go deep into this prostate. And I can reach part of the prostate that you can never reach with oral therapy. I treated hundreds, maybe thousands of these people. Some of them were almost, as I said, suicidal, and some of them were so much better after that, that instead of seeing them every couple of months, I see them every couple of years eventually, and I had as much as 19 referrals from one patient that sat in my chair. Okay? Now, this is what you can do with prostatitis. I call it Prostacone 3+ therapy. It's a cone of magnets plus the suppository plus the antibiotic, and in Germany we have an antibacterial vaccine called Strovac that you can give after these treatments. So they sit in the chair actually 4 weeks, 5 times a week, 2 weeks with antibiotics in the vein, and 2 only the chair. And this is, in my eyes, 30 years urology, the only thing that really works in chronic prostatitis and pelvic pain in men.
Does that get rid of the stone or no?
You do not. This is what I was intended to say. If anybody tells any chronic prostatitis patient that it can be healed, it's not true. You cannot heal a chronic prostatitis because you cannot eliminate these stones from the gland. You can increase the periods between the acutizations of the chronic prostatitis, sometimes so long that are years. And this is actually something amazing, because some people come every 2 or 3 months with a recurrent prostatitis, and you cannot help them. Okay? Mm-hmm. With this Prostacone 3+, I had patients that I saw before I had this therapy option 2-3 times a year. I see them now every couple of years, and can I make it again, even as a prevention, so that they don't fall again. So I have developed an instrument to help these people, really help these people, and in most of the cases it works amazing.
Is it in the United States?
Well, the therapy exists, the chair, we have a couple of hundred of chairs in the United States,
Okay.
but we have an FDA for incontinence in women. So this is the FDA. When you have the system, you can do, if you can be responsible for what you do, it's off-label use, but you can offer this stuff. I do that in Europe. I have the system now available in 58 countries. So I taught every one of my doctors or centers that use my system all I know about it. So they know. I cannot tell what the people do, but you can do that with a system.
Okay. Now let's talk a little bit about the bladder.
Okay.
I know quite a few people that have had bladder cancer.
Okay.
And in the research that I've done, and if you look all over the computer, there's a lot of lawsuits going on about certain medications that people took before and developed bladder cancer. Now, did you hear about that in Germany?
Well, bladder cancer can be induced by smoking, for example.
Right. Mm-hmm.
Bladder cancer can be induced by working in some factories with color substances. Okay, so you can develop with asbestos. It's also for the lung and also for the bladder. So there are some jobs that expose patients to some substances that can induce bladder cancer. And actually, the most known and developed and knowledgeable about that is smoking. Mm-hmm. So, and you cannot sue anybody for that because you decide yourself if you smoke.
But there are many lawsuits going on because of different medications that people took. I don't have them here in front of me, but and people are suing because they took this medication for a long time and it caused them bladder cancer. Now,
I cannot tell you about that in Europe now.
Okay. Now, is there any other medication or anything that you've heard that's out there that could cause prostate cancer?
Prostate cancer?
Yes.
Well, it is said that eating red meat after a certain age could induce prostate cancer. If I would know why, I would have a Nobel Prize for that. So you don't really know about that. But actually what people should know is that any cancer is developed because there is a reason for that. So they will have to look inside of them and find the reason why they get a cancer. When you treat cancer, for example, like Dr. Caldwell, you can really do that and you get rid of the cancer. But if you don't find the reason why you had the cancer may come back even worse than it came the first time. So you have to find out the cause. And he developed a system how to find out which the cause is of your cancer. Mm-hmm. And if you find the cause, then you can cure it better. And actually, what we know in the normal medicine, and this is easy to talk about, is if you would have a good immune system, we develop 5 to 6 times in our lives a cancer anyway. But our immune system is, if it's strong enough, it's able to kill it. Okay? So what you need to do is to live a life that will maintain your immunity in a high level so that you can protect yourself from everything outside. This means, again, from what we talked about already, discipline. Mm-hmm. It's not easy to go in the restaurant and order a salad when you can have a steak. It's not easy to drop out the desserts because it has sugar. And sugar is something that feeds the cancer, okay? And feeds the diabetes, of course. It's not easy to eat raw. It's not easy to make 4 to 5 weeks, twice a year, some cures to fasten, because it was demonstrated that if you fasten 5 days, not eat anything, you bust your immune system after 5 days. Your immunity will be stronger. This is why I believe I'm Orthodox, okay, Orthodox Christ. So we have 4 times a year fasting times. Why? Because I see the Bible as the operating manual for us. And if you read it right, you will understand how we function. And if the Bible says you need to fasten the 6 weeks, 4 weeks, 2 weeks in summer, whatever, this is just to protect your body from what the nature offers you. So if you would do this fastening time, of course I eat sometimes a steak, but if you leave 70% okay and 30% you sin, it's still okay. And you say about meditation, right? This is also why you go in church and how do you call it in English now? In German you say beichten, confess.
Right.
When you have a problem, you get to a friend and you whine on his shoulder and say, I did that and I did that and did those. When you finish confessing, you feel better. You get out the negative energy out of you and you give it to the other one. So it's up to him to make his homework, to clear himself, and this is what the priests are not taught for. So this is what the spiritual stuff is. Some people call it meditation. Of course, how you call it, it doesn't matter. But you have, as you say, Sal, connect the body with the soul, because there is a community in all of that, and they are interchangeable. And you cannot have the one right and the other not right. So if one suffers, the other one suffers too. So if you can bind them together and find a way to balance that in your life, then you can have a good life in a healthy life.
Right. You know, it's amazing. I always like to interview people. Many years ago, it's got to be 30 years ago, I spoke to this person. I happened to see him eating lunch, and he was by himself and on a construction site. And I said to him, he was an older guy still working in construction, and I said to him, wow, I said, what is your secret? I mean, you look healthy. I mean, so you know what he said to me? This is many, many years ago. He said, you know, if you don't live in the fast lane and you take care of your family and you try and stay stress-free, don't let really things bother you, because, you know, they're only temporary. And these people that go out and they have to go out all the time, and they got to go here, they got to go there, they have affairs, they do this and that. They are so stressed out, he said, that it's amazing, and this is where they come down with disease. So he said you live a good, normal and life, you eat the right foods, and you try and be happy. And
Right.
And that's exactly, you know, what I've been doing for years. I've been in business myself many years ago, and what I did, I used to get stressed. And I always had a cold, I had this, I had that. So what I did, I became a hypnotherapist, and I learned how to relax, and I learned how to cope with different problems. So it helped me tremendously with meditation. I had Dr. Caldwell on 2 or 3 times on our show already, and he agrees, like mostly all doctors agree, that emotions play a big role in whether you're going to get disease or not get disease. So eating the right foods, keeping your pH up to where it should be, and not making your stomach acidic with all these bad foods, and the right emotions, you know.
It's an attitude problem. Actually, in our lives, the only thing that we can control is our own brain. We got that from God, who said, you're free to decide for yourself. So if you have the right attitude, there is an amazing good book from a very good friend of mine, a mentor of mine, Jeffrey Gitomer. He's a sales guy. Actually, he wrote the Sales Bible and many other amazing books, and one of them is the yes attitude. You don't have a positive attitude, you have a yes attitude. If you get the attitude right, then you will understand and the stress will not be a problem. He was also the one who taught me, for example, if you love what you do, then you're in a holiday every day. So you have challenges in your life, but it's not stress. And as Dr. Caldwell says, actually every kind of disease comes from stress. This is the first actually factor that will disturb your immune system. Stress will go down your hormones, and the hormones will change everything. Okay?
Right.
So if you can control your brain, you can control your body.
Right.
It's what the diabetic, for example, cannot control. He cannot control his brain to say no. Some people need to learn in life to say no. And this is a very difficult thing to do, say no.
Mm-hmm. Okay, can we talk a little bit about older men and enlarged prostate? Now, as you get older, I heard the prostate gets larger. So I found something that I take. It's called flax hull lignans, and I get it on Amazon. It has a lot of flax oil in it, and it has omega-3 in it. And that has been helping me at my age. Supposedly it's supposed to shrink the prostate and get it to where it's supposed to be. Did you ever hear that before?
Well, it's all kind of fantasy outside there. Okay? I tell you the urological truth about that. So if the prostate is big or not big is not important. If your urologist will say, oh gosh, you have a big prostate, he doesn't know very much about your prostate. He doesn't understand very much about prostate. I had patients with 160 gram prostate, normally 25 to 30 grams, with 250 grams prostate. They urinated amazing good. It's not a problem, okay? Because what produces that so-called subvesical obstruction, okay, is how the prostate develops. If the prostate develops inside the urethra, you will have an obstruction and you have problems. If it develops outside the urethra, it can be big and not make you problems, okay? So I have patients with 25 gram prostate, I needed to do surgery. When you have a big prostate or small prostate, whatever prostate you have, it's your genetical stuff to have that prostate, okay? You don't grow a prostate because whatever. It's your prostate, okay? You cannot make it smaller. If you have an inflammation on top of this adenoma, and you have an adenomitis, an inflammation in the prostate adenoma, which develops only for the periurethral part of the gland, not for the whole gland. It's what you take out with surgery, lasers, tuna, whatever you do in surgery. You only take this capsule out, the inner part of the prostate, not the whole prostate. If it's it's not a tumor, okay? So the volume of the prostate is not so important. It's important how this prostate develops. In order to know what to do, what most of the doctors do not do, you have to look in the urethra. You have to look and see what happens. It's a cystoscopy. We have I use since 20 years only flexible cystoscopy. It's like you put your finger in the nose. It's not pleasant, but it's not achy. I do it in 3 minutes. You don't need narcosis. You just look inside. It's like you go to the dentist. You don't want to open the mouth to see what's inside. If you want to see what's in the bladder neck, you have to look in the prostate. Ultrasound will not help. Okay? You look that for 30 seconds, you know what to do. If it's an obstruction, you have to take the obstruction out. Now, you cannot take obstruction out with medication because it's not possible. We have in urology for the first stages of BPH, the alpha A1 receptor blockers, okay? Many medications. Then when you block that, you will relax the bladder neck in a way. So the bladder will empty better. But when you have rest urine, means the bladder is already so damaged that it cannot contract enough, so it develops rest urine. If you do not have rest urine, you are in a compensating phase, and you can do stuff. For example, tuna. Tuna was developed from Medtronic, called transurethral needle ablation of the prostate. Okay? Tuna alone does not work enough. It works sometimes, but not enough. I was one of the first who did tuna in Europe, and I do thousands of tunas in my life. The problem is that I put all my tuna patients in my EXMI neo-control chair, and I can explain you why. Because when you do tuna, it's a radio frequency. You destroy tissue by puncturing in the prostate some needles. Okay? You increase the needle temperature 110 degrees in 30 seconds. Okay? And you puncture the prostate in many places. So you make more necrosis into the prostate, left and right. Okay? When you finish this procedure, the body will take this necrotic tissue out. The problem is, again, the prostate is a weak-flowed organ. So if I did tuna for, let's say, a 60-gram prostate to 2 patients, one I did 10 punctures, one I did 10 punctures. But one of them I put in the chair after surgery 4 weeks every day, and one I didn't put in the chair. The one put in the chair, they had 40 to 60% better results than the other one. So one day Medtronic came to me and said, why are your results better than what the literature says? He said, because I put them in the chair. So they sent me to teach tuna in other countries. I was a proctor for Medtronic in many countries. I introduced their tuna in Kuwait, in Malaysia, in Philippines, in Morocco, whatever. They send me there, I teach them, I operate live, and I teach the people how to do it, and they have to take the chair for me in order to have the results. I tried for years to explain to Medtronic guys that only the combination with the EXMI, their tuna, functions. I had an appointment with the vice president of Medtronic many years. She never came to the appointment. So the tuna was not good enough without my chair. So what happened? Medtronic sold the technology to another company called Urologist. As I heard that my deliveries, the cartridges were not Medtronic, were Urologist, I called the CEO from Urologist and said, look, I'm the one who actually introduced the tuna in many countries for Medtronic, and I know that the best BPH treatment in the world is tuna plus the chip. Can you want to do with me a study to demonstrate that placebo control, that your technology is the best BPH treatment? if you believe it or not, they never came back to me in the past 3 years to do that. I know that most of the people who did tuna in the past don't do it any longer because the results are poor. So I don't know for what they paid the money if they don't want to make it happen. Mm-hmm. What I do for my patients, and you will understand most probably, when you start having a BPH and you go more often on the toilet, but you do not have rest urine and you're only 48, 50, 52, I did my father. I would not do anything to myself. Why wouldn't you do an ambulant procedure that takes about 25 to 30 minutes, local anesthesia? I was the first doctor doing the tuna in local anesthesia. Get 20 to 60% of the prostate away, disappearing. So you give them freedom for the next 20, 30 years. Why should you take medication for the prostate when with such a small, minimal invasive procedure, local anesthesia in your office, you can help them for the next 20 years? Why should I take medication? Why? So I had that many people because I offered that. It's a sales law. If you do not offer your service or product, the answer is always no. Mm-hmm. And also, if you know that your service or product helps the other one, you're obliged to sell it to them. Okay? Mm-hmm. So I believe that today I may be the only doctor in Germany who still does tuna.
Mm-hmm. Okay.
And I'm successful. I still get referrals from the tunas, and people still invite me in other countries to go in private clinics and do tuna for them. It's an amazing, simple procedure that you can learn in 2 or 3 hours with me aside of you. And unfortunately, not many people do that and do not understand how it really works. But it's the best BPH treatment ever invented.
Mm-hmm. Okay. Now, talking about the prostate again, the infection in the prostate, I've read and heard that some men, when they have sex, the sperm doesn't come out completely. Some stay in the tubes. Now, could that be causing infection or a problem?
No. No, the infection is caused by ascendant infection. So, for example, you have sex, and then you turn on the other side and go to sleep. Okay? Having sex, the mechanical stuff, will get some bacteria into your urethra. Of course, when you ejaculate, you wash away the urethra, but you don't wash it completely. So if you do not go to pee after sex, the bacteria that goes in the first part of your urethra, because you have this fluid sperm going up in the night, they will get along, most probably ascendant, go into the prostate and make you an infection. And this is how it most probably happens. I believe so, because you don't get an infection when you have an infection in the nose, in the ears, you get a prostatitis. You don't get it. So you only get it ascendant. So it has to come from somewhere. Where it's coming from? It's coming from urethra. Where do you put your urethra? The only thing you do is you have sex. Mm-hmm. Even worse, you have anal sex, mm-hmm. which is worse. Not okay. Mm-hmm. Okay? So this is how inflammation, infection in the urethra and prostate comes in the first place. Mm-hmm. So this is what happens. And then, as I said, the first symptoms are very similar to a normally bladder infection, and they are undertreated. Mm-hmm. They don't treat the prostatitis, only treat the urethra. Mm-hmm. So they will get a chronic prostatitis and you will have a customer forever.
Mm-hmm. Okay. Now, we're going to talk a little bit about the PSA and some people. Now, I heard even women could have a PSA reading. So
No.
how? No.
No.
Is that right?
PSA, no, it's not right.
Okay.
PSA, the name is prostate specific antigen. So it is a glycoprotein that is secreted by the prostate cell itself. This is why it's called PSA. It's a specific tumor marker, specific protein, glycoprotein secreted from the prostate cell. A woman doesn't have a prostate cell, so women cannot have PSA.
Okay.
All right?
Okay.
So this is easy.
Okay, so now can we talk a little bit about that test and how good it is?
Well, it's an instrument to see what happens into your body with a prostate. If you have a large prostate, you have more cells that could secrete more prostate, PSA, this antigen. So the normal PSA will be between 0 and 4. That's the normal range, okay? But you can have somebody with a large prostate not having a cancer and have a PSA of 5 or 6 or 7, maybe. There was a second PSA called free PSA that was developed many years ago. So this glycoprotein runs in blood alone, free, and runs also linked with other proteins. So you have an antibody antigen test that will cover all the PSA, and that will cover only the free PSA. And there is a so-called PSA quotient, so it's free PSA divided by PSA times 100, and that should be over 25 if you don't have a cancer, okay? Between 20 and 25, 15 and 25, it should be the so-called gray zone. You may have a cancer, you may not have a cancer. In my experience, literature, but my personal experience, if you have a quotient of less than 15%, actually you have a cancer. You should find it, okay? I tell you that for example, because 2 years ago, I most probably had a cancer. I had a PSF of 6.9 and with a quotient of 11%. So according to what I teach my patients since 30 years, 20 years, I had a prostate cancer. What I did was the treatment of Dr. Caldwell. I did 6 weeks only raw food, take his H2O2 35% food degree. I alkalinized my body. I detoxed my body. 3 weeks later, the PSA was already down to 3 point whatever. I say I will not look again at my PSA. I didn't look at the PSA for 1 year. 1 year later, my PSA was 1.1 whatever. I didn't look again. 1 year, and this year in February, my PSA was 0.9 whatever. So I suppose that I don't have a cancer any longer. I do not know for sure I had it, but the way I had my PSA numbers, I should and must have had that tumor. Okay, I didn't see it in the MRI. I didn't see it. I didn't see it in ultrasound. I did all the diagnosis that was possible. It was not to see. So people could say you didn't have it. I will never know if I had it or not. But according to what I know and how I diagnosed and treated my patients 20 plus years, I must have had it. Okay? Mm-hmm. So I still do 2 or 3 times a year these cures, and I'm living about 70-75% the way these teachings say to me. I feel amazing good. I feel healthy. I advise many of my patients and friends to do that. I have all my family on this stuff, and many of my patients and friends on the therapy. I have a lot of guys going down with a PSA from 17 to 5 to 4, whatever. I have people who don't have it any longer. And there are not so many because people are not so confident in this alternative therapies, and most of them will do surgery. If they don't follow my steps, I control the PSA when they do that every month. If I see that they do not respond or the PSA even raises a bit, I advise everybody to go to the normal medicine, go to get a radical prostatectomy or radiation or whatever all the alternatives are on the market. They have to decide for themselves, but then I don't take care of them any longer because I don't want to, this is not my philosophy any longer, okay? When I send a patient to surgery, I know exactly where I send them because I most probably operated with these doctors and know what technically skilled they are. So I test my doctors where I send my patients so that I can be sure I would go there myself or someone from my family. So I'm happy when they come back from surgery or from radiation or whatever. I say, thank you, doctor. It was a good recommendation, and I'm okay. So I combine both normal medicine and alternative depending on the patients. Some people are not to be recommended alternative because they cannot make it. So if I find their brains cannot follow me, I stop relatively quickly and do the normal medicine that everybody knows.
Right. What you said before in regards to when you get older, you get an enlarged prostate. Usually, people of my age get a 5, 6, or 7 score on a PSA. So that must be the reason why you can get a higher score if you're older, because of the enlarged prostate. Is that right?
Not necessary. I tell you something again, that the way I'm treating my patients with a PSA, okay? So if you have PSA and you know about this PSA, if the PSA, for example, doubles, means actually the prostate cancer volume doubles. So if you can calculate, if the patient comes, in Germany we have so-called prevention, cancer prevention, okay? So you come once a year, do some ultrasound, some blood tests, and if you come yearly, you have actually a scale of your development of your PSA. So I have, since when you have the praxis since 95, I had some patients coming with me with 35, now they are 50, 55, 60, my age, a bit older than myself. So I follow their PSA during the course of the time. So I can calculate for them what is eventually the doubling of the volume of the tumor. I'll give you an example. You have a 69-year-old guy, 70, right? No, 65, let's say 65. And you had a PSA last year or the last 2 years of 3.5. Now you have it 4.2, okay? 3 years ago, so the PSA raised in 3 years from 3 point whatever to 4 point whatever. So let's say 25%, okay? So 3 years is 25%. If you go to a normal doctor, normal office, you have a PSA over 4, they make you a prostate biopsy, right? I don't. I say, look, I see you, your patient. My professor that taught me medicine and urology, my first mentor, Professor Dragan in Romania, he said, there are no diseases, there are only patients. So every one of the patient is unique. So I take it, diagnose it, and recommend stuff for him, for himself, not for him, not for general. So I take him. I look at his story, I look at his medication, at his situation today, and I take my urological decision about a tumor, for example, according to what his physical, healthy situation is today. So let's say I have a pretty healthier guy, 65, with that raise of the PSA from 3 years of 25%. I said, look, Mr. John, you have a PSA of 4.2 now. You had it 3 years ago, 3.5. So you had a raise of 25%, let's say. All right? So your doubling of the tumor is actually 12 years. So if I will not do anything to you, another 9 years, you will have a PSA of 6 or 7 when you are 74. So what? I don't care. So let's take another 12 years and you are 86 and you will have a PSA of 12. Most probably you have a tumor. So what? Okay? I don't do to this guy nothing. I follow him maybe twice a year with PSA, not once a year as I did before, to see if something happened in his life, in his immunity, that will make the tumor burst, so that I can catch the moment where eventually I could do something or I should do something. All right? Mm-hmm. Let's say something for the people hearing me, something that most probably many doctors don't say. Okay? With 70, about 90% of men have a tumor in the prostate. From that 90% of men having the tumor in the prostate, only 10% of them will have symptoms related to that tumor. And from that 10% of the men having symptoms due to the tumor, only 10% of them die from the tumor. So actually with 70, if you have a prostate tumor, only 1% of men will die on the tumor. Mm-hmm. So is it actually right to biopsy and operate so many people on the tumors of the prostate when actually if you don't do and watchful waiting will actually give them a better life for many years to come? You'll never know if a 78-year-old will not die on heart attack or stroke or something and will die with a prostate tumor inside without needing them to be incontinent eventually or having sexual problems if he still has sex eventually or any other problem. Why should that? So I decide on what it has to be done. I don't decide. I suggest what it has to be done according to what my patient is today. Mm-hmm. Okay? He needs to decide for himself, but I give him the options. Right. And I'm fair enough to give him almost all the options that he has and to teach him what is good, what is pro and con for every option so that he can choose. Because if he doesn't have the knowledge, he cannot choose. Mm-hmm. Okay?
You know, years ago, I spoke to another urologist, and he said to me, if a guy lives long enough, he's going to have cancer, the prostate, you know, if he lives long enough in his life. So then everybody, then it's one, everybody has cancer then.
I said, with 70, about
absolutely.
6% of men would have a cancer inside.
Right. Okay.
But this will not kill him.
Right. Now, can we get to another subject? There is a lot of lower back pain with pinched nerves in people all over the world, between an injury, sports injury, between degenerated discs and this and that. Now, the pinched nerve, does that, I know in some people it affects the penis. Now, and probably other parts of the body. So now, is that dangerous to have a pinched nerve and just treat the symptoms for that? What is your take on that?
Okay, so low back pain is something that most probably 60 to 80% of the population has. And the problem is that it's a non-balanced pelvis, okay? If the pelvis is not right, and you have one leg longer as the other one, okay, that will keep your pelvis in a certain this position, okay? So if the pelvis is, for example, to the right, the first 3 or 4 vertebrae, in order to compensate, will go left. For another 2 or 3 vertebrae to compensate, they will go right, and left and right, and left and right until your neck. So you will have actually an S spine.
Mm-hmm.
So if you do sports, whatever, you should go from time to time to the osteopath or physiotherapist to put your pelvis in the right position, okay? So that this position will compensate actually and will put all the spine in the right position, because if you don't do that, you will have problems. You will start with a low back pain, then you will have a knee problem, and you will have an Achilles problem, and then you have a neck problem, and everything goes from one to the other. So that's the problem.
No, my question is, when you have nerve damage,
yes,
it affects body organs.
Depending on when you have the speech, of course.
Now, is that dangerous? Is that a dangerous thing?
Of course it's a dangerous thing, because if you have a compression of a nerve, then actually the information coming from this nerve to the end organ, whatever it is a muscle or it is a part of the spine that is compressed, that will go to the bowel, that will go to the heart, that go to the lungs, to go to the kidneys. You will still have problems in the end organs, of course, and you have to release the nerve. You have to release the nerve, because otherwise, first of all, you have pain. And if you get over the pain, compensate, you will have problem in the end organs anyway. Mm-hmm. So, yes, the answer is yes, it is dangerous. You will have damages on the end organs if you have a problem with the nerves.
Okay. Now, talking about the bladder, a lot of people, men, when they get older, they have bladder infection in the bladder. Now, is that whether they have sex or not? So, how do people, and a lot of older people I hear, get bladder infections?
Well, most of these people most probably have a BPH and rest urine. If you have a rest urine, the urine is a very good medium for bacteria to develop. So if you do not empty the bladder, so that the walls of the bladder will come together, in the mucosa of the bladder, there is immunoglobulin A. So if the bladder will be empty when you finish urinating, okay, then the immune capacity of the mucosa will kill the bacteria that will be in the folds of the bladder mucosa. Okay, if you have rest urine, you have some stagnating urine that is full of protein and sugars, a bit, something, not much, but you have a medium for the bacteria to develop. There is described a so-called renal bladder circuit of the coli bacteria. Okay, so we have bacteria inside the urine. but our immunity and the immunity system of the urinary tract will be able to sterilize this urine. But if it's not emptying the bladder, then you get then you have often infections. Mm-hmm. So actually, a really empty bladder in men will actually keep you infection free. If you do not empty the bladder, you are supposed to get more often infections. So it's about this subvesical obstruction. Is that the bladder neck, the prostate, the urethra, the sphincter, the meatus, of the outer opening of the urethra, and with children, for example, phimosis. Mm-hmm. It's the same stuff as the old man. You get an infection because it doesn't empty. Mm-hmm. Okay. And you have to see if the channel if the urinary tract under the bladder is open or not. Mm-hmm. Cystoscopy, very easy.
Okay, I spoke to you about the insurance. There's an insurance, it's called ONA, ONA.com. If you go to that website, you'll see it's an Indian tribe that will give you insurance. And with that insurance, you can go and they'll pay for that table. Or they'll go to an alternative treatment doctor and take his treatment. That's what I wanted to get out there and make sure that you got. It's ONA.com as their website. And I got that from Dr. Young. He's an alternative treatment doctor. You can go on some of my YouTubes on YouTube and look under Dr. Young, Sal DiBella, then Dr. Young, and look at what he has to say about the insurance. And he's trying to promote it. And I've told a number of doctors about alternative treatment doctors about this treatment. So is there anything, the insurance, I'm sorry, is there anything you want to say before we close that you want to tell people out there?
Well, people should take their lives and their health in their hands. They need to understand that from nothing comes nothing. Then if you do not do some prevention measures in your life, you will have problems. And the more undisciplined you are, the more problems you will have, and the less you will live. So if you want a healthy, long life, you need to discipline yourself in eating, in everything that you do, to try to diminish the stress, get to change your attitude, be happy, because we are on this earth only for a short period of time, and we deserve to be happy.
Okay, that's great. Now, if someone wanted to get in contact with you, how would they do that?
Well, they could get on the on my homepage. It's www.neocontrol.de. It's neocontrol, N-E-O, and control.de, like Deutschland, D-E, Detroit, Emily. Mm-hmm. And there is actually something about my systems, and there is an email address, info@kitalpha-med.de, and I get to everybody back.
Well, I want to thank you for being on the Health Show. I think we gave a lot of people a lot of good information.
I hope so too, and thank you very much for inviting me.
You're quite welcome. Thank you.
Thank you, Sal.
So there we have it, Dr. Jordon. Much information, and I hope you look at the whole video on TV and on YouTube. So I want to thank you for joining me on the Health Show, and we'll look forward to seeing you again the next time.